Now to solutions. What options does government really have to deal with the alcohol abuse during this pandemic? My guest, Professor Charles Parry, Director at Alcohol and Drug Research, South African Medical Research Council, suggesting different models that government can use. Professor Parry, good evening and thank you for your time tonight. First and foremost, we are hearing anecdotally from the Premier of Gauteng, from the Premier of the Eastern Cape, even the Premier of KwaZulu-Natal, that the number of trauma presentations have increased. To what extent do we have data to back this up?
Yeah, thank you, Thabo. We've been looking at data around the country, speaking to doctors in trauma units. The Western Cape, for example, has data from 5 hospitals way back from January right through to the end of June. We've got some data from KZN. And it seems that basically we're about 80% of the trauma presentations that we had pre-lockdown. But that's still a lot more than we had during lockdown levels 4 and 5. So we're almost back to where we were in March.
And how does
which is about 34,000 per week coming to public trauma facilities around the country.
Yeah. How does this link up with the fact that there is now access to alcohol readily available, plus also the fact that it could be happening because people are now more free to move and it might not be alcohol related?
Yeah, I mean, there's always been a strong link between alcohol and injuries. And as we've done some modeling this past week to try and work out, what proportion of trauma visits are alcohol-related and what numbers we could see if there was a ban instituted. So that's what we've been looking at. And certainly our figures are about half of all trauma admissions now during level 3 are alcohol-related. And that's about 17,000 out of the 34,000 per week that appear at the public hospitals around the country. So that's 17,000. And our model comes to the position that if a ban was instituted, initially you wouldn't see much of an effect, and certainly the effect wouldn't be as great as it was during levels 4 and 5. But it might start out. It would probably start out about 20% drop in the first week after a ban on liquor sales would take place, and it would rise probably over about 3 weeks to about 40% and then flatten off after that. So we might see a saving of just under 7,000 admissions per week across the sort of 350 plus secondary and tertiary public hospitals which have trauma facilities. That may not sound a lot, but over an 8-week period, we calculated that would be just under 50,000 trauma admissions and presentations which could be averted. And that certainly translates when you work out the average number of days spent in general wards and also in ICU facilities. We'd probably save in the order of about 124,000 days less spent in general wards and 46,000 less days spent in ICU. And certainly when the hospitals are under a lot of pressure that they are now, that's certainly one solution, an option that the government has to consider. It may not be the only approach, but certainly it's certainly one approach to look at this time.
We saw in the 9 weeks, the first 9 weeks when alcohol sales were completely banned, a loss reported by SARS of 1.3 billion rands in tax duties. And is that a fair enough compromise to make as far as the number of beds that will be created?
Yeah, I'm not sure if that was also cigarettes as well, but
with cigarettes it went up to 1.6, but just the alcohol, the spirits, the wine and the beer, that's 1.3 billion.
Okay. Our modeling this past week estimates that in terms of consumables, when someone doesn't come into the hospital, you don't save the costs of the salaries and the buildings and that. So our estimates are that if we banned alcohol sales over an 8-week period, we would save 360 million rand across the public hospitals in consumables. That's probably less than we would, that's certainly less than the government gets in excise tax. But you're looking at sort of having to come to a situation where a doctor is going to have to say, well, we've got too many patients coming in. What's the likelihood of a good outcome of a trauma patient versus a COVID-19 patient? And they may well say, someone coming in with a stab wound, we'd rather admit them because their chances might be greater. So we don't know. That's one of the sort of situations that we're facing. Do we let some of the income go from the tax revenue, or do we save lives? So those are the sort
Yeah.
of critical and difficult decisions.
Speaking to the Liquor Traders Association of South Africa moments ago, they're quite open to different models, including the ones that you're suggesting, plus the one of decreasing the number of days and maybe even decreasing or limiting the purchasing amounts. What are the benefits of that, and how does that work?
Yeah, certainly. One of the options we've been putting forward, a number of us, and the South African Alcohol Policy Alliance, as well as the Medical Research Council, would be, and this is the options I put forward way back in mid-May, that the government, before considering instituting another ban, look at sort of lesser measures, which might include a number of measures around reducing availability, perhaps reduce the days to selling for 3 days a week, limit the amount that can be purchased, particularly so you don't have people buying bucky loads of alcohol and then selling them on. So that should be stopped. And there are also limits around, things around perhaps not selling alcohol in larger containers. We know from our own research at the MRC that selling alcohol, beer, for example, in larger containers like the 750 and 1 liter containers has been linked to heavy drinking. And we even know that one of the bylines for selling Carling Black Label 1 liter is made for sharing. So perhaps we should be saying to the industry at this time, if you're selling beer, perhaps it should only be in a 350 ml container, not the larger containers which are known to be shared and particularly problematic. Perhaps also we should be taking away the advertising of alcohol and only permit the marketing of alcohol at the point of sale to allow people to decide which products to purchase, but not have sort of aggressive marketing encouraging people to buy alcohol in this time.
What would be the benefit of that? Mind you, also, that would mean you're affecting another industry, which is the advertising industry and the outdoor advertising industry in particular. But what would be the direct impact of that and the benefit of it?
Well, marketing has been shown to be linked to increasing consumption. When we look at young people, the international research is showing that marketing gets young people to drink earlier and to drink in greater amounts. And certainly at this time, we don't want people drinking greater amounts. We want, if people are drinking, we want them to be sensible and not. The trouble with South Africa is that while we only have 31% or perhaps slightly more of the population drink, the World Health Organization has shown that we're the 6th highest nation in the world in terms of the amount of absolute alcohol drunk per day per drinker at 64 grams. So that's between 5 and 6 standard drinks per day per drinker. So many of us don't drink at that level. So many people must be drinking way above that level. And that's the problem in this country. The liquor industry is dependent on quite a large proportion. In fact, 60% of drinkers in South Africa engaged in what's called heavy episodic drinking on a monthly basis. So we're not a nation who drinks moderately, and that's the problem. So we've got to do all that we can, from reducing availability to looking at pricing to looking at the products that are available, and even things like perhaps we've been talking. The country has the cabinet approved the Road Transportation Amendment Bill, which reduces the blood alcohol concentration maximum for drivers to 0. I think we should be looking at perhaps even in this time of level 3 to reducing it at least to 0.05 to send out the message that if people are going to be driving, they shouldn't be drinking at all. To try and get every person who could be coming into the trauma unit for whatever reason because of their drinking, not to. Otherwise, I think the government's hands are going to probably be forced eventually to look at instituting another ban on liquor sales.